Healthcare workers are the backbone of any health system. Without them, the best equipment and even the most modern hospitals are nothing. The COVID-19 pandemic has demonstrated how vital public health workers are to our survival, putting their life at risk to save others' lives. Yet, nurses, doctors, and many other emergency first responders suffer dangerous overworking, trauma and stress, assaults and abuses, some even eviction from their homes because of stigma. They face deadly hazards with inadequate protective equipment. More than 100,000 health workers have been infected with COVID-19 and thousands have died. But the ideological virus of neoliberalism is responsible for their loss as much as coronavirus is. Decades of cuts in public spending, privatization of health and care services produced understaffed, underfunded services that weakened the health system. While the healthcare industry is one of the largest growing industry globally, public funding for vital public health services is failing to meet the needs. In too many countries, public funding for health is being eaten up by costs inflated by the medical industry and the privatization of the existing services. The 2016 UN recommendation on SDG 3, the right to health, urged to hire 18 million health workers globally to meet the basic health needs for all. But too many nurses and other healthcare workers are still hired on short-term, low-wage and insecure contracts. Now is the time to recognize that poor wages and conditions put public health system at risk. Clapping to health workers shows gratefulness for the hard and compassionate work they do, but please don't call them heroes and then forget them until the next emergency. They are workers and professionals deserving respect, dignity, and decent working conditions. The recovery from COVID-19 will need to address the failure of the global economic system, recognize the role of public services, and invest in public health to enhance justice and reduce inequality. Uploading these underpaid and overstretched workers is wonderful, but no substitute for more staff, higher wages, safe working conditions, and democratic participation at the workplace. Ensuring the quality of their work is ensuring the quality of health and care services to patients, as safe workers save lives.